Good morning. In this video, I will read to you the paper that comes with the prescription. The prescription is called lithium carbonate, 300 milligrams in capsules. It says quantity is 60. I wrote on it the big bottle because I have the other prescription. Take 2 capsules by mouth at bedtime. Alright, so it says ingredient name lithium. Common uses. This medicine is an anti-manic agent used to treat manic episodes in patients with bipolar disorder. It is also used to reduce the frequency and decrease the severity of manic episodes in patients with bipolar disorder. It may also be used to treat other conditions as determined by your doctor. Before using this medicine, warning. Lithium toxicity is closely related to blood lithium levels and can occur at doses close to normal blood lithium levels. No idea. I'll just read it, alright? Do not exceed the recommended dose. Your doctor should monitor your blood lithium levels routinely to help prevent lithium toxicity. Contact your doctor immediately if you experience symptoms of toxicity such as nausea, diarrhea, vomiting, blurred vision, ringing in the ears, drowsiness, giddiness, muscle weakness, tremors, twitching, seizures, loss of consciousness, back and forth eye movements, loss of coordination, or increased urination. Some medicines or medical conditions may interact with this medicine. Inform your doctor or pharmacist of all prescription and over-the-counter medicine that you are taking. Additional monitoring of your dose or condition may be needed if you are taking a bunch of words I can't pronounce, inhibitors, a bunch of other ones, calcium channel blockers, iodide preparations. Do not start, or other medicines for mental or mood problems. Do not start or stop any medicine without doctor or pharmacist approval. Inform your doctor of any other medical conditions, including diarrhea, vomiting, excessive sweating, dehydration, fever, infection, illness, psoriasis, brain or nerve problems, meaning organic brain syndrome, kidney, heart, or thyroid problems, allergies, pregnancy, or breastfeeding. Tell your doctor if you have or are suspected to have a certain genetic heart disease, such as Brugada syndrome, or you have risk factors for it. For example, unexplained fainting, family history of Brugada syndrome, family history of sudden unexplained death before the age of 45 years. Tell your doctor if you are on a low salt diet or if you are in a weakened state. Use of this medicine is not recommended if you have moderate to severe kidney or heart problems, low blood sodium levels, or you are severely dehydrated, ill, or weakened. Use of this medicine in children under age 12 is not recommended. Discuss with your doctor the risks and benefits of giving this medicine to your child. Contact your doctor or pharmacist if you have any questions or concerns about using this medicine. Do not take this medicine if you have an allergic reaction or are allergic to any ingredient in this product. Several days to weeks may pass before you feel the full benefit of this medicine. Well, it didn't give me any benefit. Number one, I don't believe I'm bipolar. Number two, I was diagnosed when I went for marriage counseling, and all the marriage counselors just take the spouse's side, the female spouse side. All right, so it says here, possible side effects. Side effects that may occur while taking this medicine include drying or thinning of the hair loss, mild hand tremor, mild loss of appetite, mild thirst, mild tiredness, or temporary mild nausea and general discomfort at the beginning of treatment. If they continue or are bothersome, check with your doctor. Contact your doctor immediately if you experience back and forth eye movements, confusion, diarrhea, dizziness or lightheadedness, drowsiness, dry mouth or eyes, fainting, giddiness, inability to control the bladder or bowels, increased thirst, what's the next line? Or decreased urination, increased or decreased urination, involuntary twitching or muscle movements, loss of consciousness, loss of coordination, muscle weakness, numbness of skin, restlessness, ringing in the ears, seizures, severe or persistent headache or nausea, shortness of breath, slow or irregular heartbeat, sluggishness, slurred speech. Now, I did have slurred speech the first time they gave me this stuff. I took it because I believed that I was not going to be let out of there unless I took this stuff. The first time was in Christmas. Sluggishness, slurred speech, swelling of the ankles or wrists, tremor, unsteadiness, vision changes, blurred vision, vomiting or weight changes. An allergic reaction to this medicine is unlikely, but seek immediate medical attention if it occurs. Symptoms of an allergic reaction include rash, hives, itching, difficulty breathing, tightness in the chest, swelling of the mouth, face, lips, or tongue, unusual hoarseness. This is not a complete list of all side effects that may occur. If you have questions about side effects, contact your healthcare provider. Call your doctor for medical advice about side effects. You may report side effects to the FDA. All right, so that was the info about this big bottle. It says $0. Well, I already threw the medicine in the toilet. There's another video where I did that. 8 minutes. All right, I'll read to you the other one. It says $0. Oh, but your insurance just paid $1,097. And the medicine is called Quetiapine. 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 What in the world was I given this for? I don't remember. But they do both of them at the same time when you're incarcerated with the Hospital Baker Act situation there. Common uses. This medicine is an atypical antipsychotic used to treat schizophrenia or bipolar disorder. It may also be used for other conditions as determined by your doctor. Before using this medicine, warning, this medicine is an antipsychotic. It may increase the risk of death when used to treat mental problems caused by dementia in elderly patients. Most of the deaths were linked to heart problems or infection. This medicine is not approved to treat suicidal thoughts. No. This medicine is not approved to treat mental problems caused by dementia. Antidepressants may increase the risk of suicidal thoughts or actions in children, teenagers, and young adults. However, depression and certain other mental problems may also increase the risk of suicide. Talk with the patient's doctor to be sure that the benefits of using this medicine outweigh the risks. Family and caregivers must closely watch patients who take this medicine. It is important to keep in close contact with the patient's doctor. Tell the doctor right away if the patient has symptoms like worsened depression, suicidal thoughts, or changes in behavior. Discuss any questions with the patient's doctor. Some medicines or medical conditions may interact with this medicine. Alright, it's kind of boring. It's kind of like the same thing. Do not start or stop any medicine without doctor or pharmacist approval. This medicine may cause neuroleptic malignant syndrome that can be fatal. Contact your doctor immediately if you develop fever, stiff muscles, confusion, abnormal thinking, fast or irregular heartbeat, and sweating. Before you begin taking any new medicine, either prescribed or over the counter, check with your doctor or pharmacist. Caution is advised when using this medicine in the elderly because they may be more sensitive to the effects of this medicine. Increased blood pressure has been reported in children and teenagers who use this medicine. For women, if you become pregnant, discuss with your doctor the benefits and risks of using this medicine during pregnancy. Using this medicine during the third trimester may result in uncontrolled muscle movements or withdrawal symptoms in the newborn. So the baby will have problems. They will have withdrawal. Like when you take a drug away from a baby, they'll be addicted to this drug. This medicine, my opinion, of course, this medicine is excreted in breast milk. Do not breastfeed while taking this medicine. Diabetes patients. This medicine may affect your blood sugar. Check blood sugar levels closely. Ask your doctor before adjusting the dose of your diabetes medicine. Possible side effects. Side effects that may occur during treatment include constipation, dizziness, drowsiness, dry mouth, headache, increased appetite, indigestion, lightheadedness, nausea, runny or stuffy nose, sore throat, sluggishness, stomach pain or upset, tiredness, vomiting, weakness or weight gain. If they continue or are bothersome, check with your doctor. This medicine may raise your blood sugar. High blood sugar may make you feel confused, drowsy, or thirsty. It can also make you flush, breathe faster, or have a fruit-like breath odor. If these symptoms occur, tell your doctor right away. This medicine may increase the amount of a certain hormone, prolactin, in your blood. Symptoms may include enlarged breasts, or decreased sexual ability in men, or missed menstrual period, or nipple discharge in women. This medicine may rarely cause a prolonged, painful erection. If this is not treated right away, it could lead to permanent sexual problems, such as impotence. Contact your doctor right away if this happens. Some patients who take this medicine may develop muscle movements that they cannot control. Contact your doctor immediately if you have muscle problems with your arms, legs, or your tongue, face, mouth, or jaw while taking this medicine. Contact your doctor immediately if you experience confusion, difficult or painful urination, fainting, fast, slow, or irregular heartbeat, fever chills, or persistent sore throat, hallucinations, increased saliva production or drooling, increased sweating, memory problems, menstrual changes, muscle pain, weakness or stiffness, new or worsening mental or mood changes. Example, aggressiveness, agitation, anxiety, depression, exaggerated feeling of well-being. hostility, impulsiveness, inability to sit still, and irritability, panic attacks, restlessness, numbness, burning or tingling, red, swollen, blistered or peeling skin, seizures, severe or prolonged dizziness, lightheadedness or headache, severe stomach or back pain with or without nausea or vomiting, shortness of breath, suicidal thoughts or actions, swelling of the arms, hands, legs, or feet, tremor, trouble concentrating, speaking or swallowing, trouble sleeping, trouble walking or standing, uncontrollable or involuntary muscle movements, for instance, uncontrollable arm or leg movements, twitching of the face or tongue, loss of balance, unusual bruising or bleeding, or vision changes like blurred vision, decreased vision. An allergic reaction to this medicine is unlikely, but seek immediate medical attention if it occurs. Symptoms of an allergic reaction include rash, hives, itching, difficulty breathing, tightness of the chest, swelling of the mouth, face, lips, or tongue. This is not a complete list of all side effects that may occur. If you have questions about side effects, contact your healthcare provider. Call your doctor for medical advice about side effects. All right, so all of this garbage, right? I'm not going to take it. I haven't exploded. I control myself. I'm not going to take vengeance, because vengeance is the Lord's. People that don't believe that, my mom tells me, when my mom got hit by a truck, RC Cola truck, I was 4 years old. My father told her in the hospital, I would have given $5 to have that driver finish you off. That's a mean thing to say. So I'm not supposed to laugh, but I did laugh. I was 25. I'm 40 now. When my dad died, I was 25. Guess how he died? He got hit by a pickup truck, by a drunk driver. So what do I think about? Vengeance is the Lord's. You sin. All of us sin somehow, right? But you go out of your way to sin, you're going to have something coming to you. All these doctors that prescribe these medicines, what I believe about them is that they are receiving a nice kickback or a nice amount of money for all the medicine that they give to their patients. Especially since, how much time do I have to talk to the doctor? Less than 10 minutes? And in 10 minutes, you're going to say that I'm bipolar. What happened was, before, I used to speed up my conversations when I was talking with the doctor, because what happens is you only have 5 minutes to tell him what's going on. So if you do that, then the doctors automatically label you, oh yeah, you're one of those speedsters, you're a bipolar. Maybe I am. What's the difference? In me, I control everything. When I hit the car with the bat, nobody was home. And in my mind, I was explaining to the spouse that every time she yells at me, it's the same thing as my hitting the car with a bat when she's not there, right? My car, by the way. And I own it with her, all right? And she sold it without my signature. But we know that there is favoritism in this world towards women in the United States. So I hit the car 5 times one weekend. Then the following weekend, she yelled again. I hit it 5 more times. The third weekend, she said, I'm going to call the cops. So I said, okay, I won't hit it. And I wrote it. I will speak softly to my husband. I will not yell. I wrote it on three sides of the car. Not in the front, but all the way on the driver's side, the back side where the luggage goes, and on the passenger door. 3 months later, she gets into an argument with me, and she calls the cops again. And of course, she mentions the bat that happened 3 months, but I didn't even tell the officer that was 3 months ago. Apparently, it doesn't matter. The best advice for you would be to live alone and to videotape everything. If you're having sex, it might be illegal to videotape them, but make sure you only have sex at your tiny home, your tiny, if you're a man, your tiny, not even a one-bedroom apartment. I'm talking about a homeless cart, all right? Something like 4 feet wide by 7 feet tall or something. Or like that. Because now you could also own like 100 houses if you want to, or you could rent a storage for your things. But don't live with a woman. And what you could do is, when she knocks on the door, there are only two reasons to knock. One, to talk to you about the kids, or two, to come and give you sex. Because that's the only conversation I want with the spouse. Because, for instance, we went to the park, and she said, "Get off the floor. Those jeans are not for being on the floor." Okay, so then he climbs a tree. Well, actually, he climbed the tree first. She says, "Get down from that tree." Now, when I'm standing up, I'm 5'10". I could grab that boy because I didn't even have to reach up. The branch was like on my chest level, so I could grab him. But this spouse that I have at this moment is my opposite. Everything I say, "Let's go," she says, "No." So I just stay in here in my room, which if you saw the videos, she wanted to rent it, but then she didn't want me to be back in the house. This room is closed off. I don't have access to her side of the house, which is fine. I just stay here. All right. So what? I'm bipolar because I don't hold my tongue. I just speak whatever I feel. Private and personal things, like how many men are there that have a spouse that menstruates twice a month? Now, I do have a family member, a relative. The relatives are farther away, right? They don't live in this house. This relative, she menstruates every 3 months, but she has 2 kids. My spouse has 2 kids. You know, life is different for everybody. All right, don't take the pills. Don't live with anyone. I mean, I could live with my kids, right? If they're going to obey. Like, I get along with my son, and I don't get along with my daughter because all she wants to do is be on the internet in her room. So, like, you want to go to the park? No. Okay, so, like, I have nothing to talk about with her. And I'm not allowed to take the internet away from my daughter because the spouse says, "You're trying to control us. I will Baker Act you again." So I just turn around and come back to my room. Some people say, "Wow, are there people really that mean?" Yes, and we live with them. I put up with it because, one, I don't have the money to move out. I don't have any job skills, money skills. 2, the main reason I live with her, beyond the money, is to help my son out. I've already told him, you start fighting with me or disobeying me, like, what do I ask him to do? What? He took out 2 trash bags today. Because they've been here a while in my tiny room. And I asked him to feed the dog, but he was playing with the cat. So, like, What did I do? I went to hug him and I said, "What did I ask you to do?" And then he said, "I don't want to do it." And I said, "Fine, then negotiate. Please, Daniel, you do it." And I said, "Sure, I'll let you play with the cat." Gave him a kiss and I let him go. Now I do hug him. Now I don't hug the daughter at all much, not much, because well, she's in her room, or she's got an attitude. Now I could take care of that attitude real quick, but since she's under the protection of the women, my mother and spouse, then I don't tell her anything. All right, do the best you can. Learn about the Bible, because there are some very good tips in there, like Proverbs. And I'm looking at an iPod. I'll get it. Remember, you are a champion. That's the alarm I put there. I got the app called Holy Bible from YouVersion on the iPod, right? And in it, they have a 3-day reading program for like kids, but I like it. I like short stuff. It says, what does it say? It says 3 minutes. Oh, like the one on anger. These are called Proverbs. There's another one called Next Steps for Kids. Read about Esther. And that one is, well, it might be the whole book, but the thing, what I'm getting at is that it reads it to you aloud so you can hear it. And there are many wonderful things. YouVersion app. Enjoy your life. Be better than I am. Vengeance is the Lord's. Now, on the next video, I'll talk about, should I be laughing that this spouse has arthritis and she can't take her clothes off and things like that. Her bones lock up and things like that. Well, not the bones, the joints. But that's karma. Sowing and reaping. You're going to be angry all the time. You're going to be tense. Then if you don't learn to swim or practice Tai Chi Chuan and meditate, then you're going to get something. Call it arthritis, bursitis, whatever it is. Unhappiness. An unhappy life. For every 10 minutes of anger, you lose 10 minutes of happiness. So avoid negative people. Avoid negative places. Anywhere that's crowded. For me. And avoid traffic jams. Avoid negative places, traffic jams. Avoid negative people. Angry people, or people that tell you bad things, like sometimes your parents, all right? Negatives. And avoid negative people, negative places, and negative things like alcohol, drugs, cigarettes. You don't need that stuff. Be a good person. Read your Bible. It's got good stuff in it. The only one I've read actually is Proverbs. Now, I heard a few others like John 3:16 and a couple of other things, but the Proverbs, they make sense now that I'm old. Because when I read it as a kid, I was like, listen to the advice of your father or something like that. Well, I don't have a dad, so like I had no advice. All right. My dad was not present. Except by accident that I was walking on the street, and there he was walking on the street. And I said, hello. And he recognized me, so like, okay, so we went to a restaurant. I didn't eat anything. And he went, "Hush!" and spit under the table. And all right. He was a rich man. Opinion. He dressed like a rich man. Girls always noticed him. Whereas I dress, I'll say casual, but I look like a tourist in some ways because the body shape and so on. But anyway, you see me riding my bicycle with my dog. Enjoy your life.